This is a role play developed as part of the course curriculum for Manage TB, an online course for doctors. The participants have enacted the roles given to them. The case discussed does not refer to any existing patient but has been developed as part of the course curriculum. The investigations such as x-rays and lab reports used in this case scenario belongs to patients treated at National Institute for Research in Tuberculosis, Chennai. Their identity have been anonymized.
Hi Shruti.
Hi, sir.
Good morning.
Good morning, sir. Sir, actually, I have a patient to discuss with you. Is this an appropriate time?
Yes, please go ahead.
Sir, actually, this patient is a 35-year-old male. He is an
Okay.
IT professional and he has presented with complaints of loss of appetite and weight for the past 2 months. And is also complaining of persistent coughing for past 20 days, sir. And is also having fever for past 1 week, sir. And is also a non-smoker and is smoking for the past 10 days. And he has no other comorbid illnesses. And sir, I have taken his lab investigation and sputum is positive for acid fast bacilli and his gene expert has shown mycobacterium tuberculosis. It is sensitive for rifampicin, sir. And I also have his chest X-ray and it shows bilateral lung parenchymal involvement, sir.
Okay. Shruti, do you have any other additional information that will help us to manage this
Yes,
patient?
sir. I have collected his previous history. There is no past history of treatment for TB, and his HIV status is also non-reactive. And as I said earlier, sir, he is a smoker and he is smoking for the past 10 years, 1 pack of cigarettes per day, and he is also a occasional alcoholic, sir. And like I said, sir, there is no other comorbid illness like hypertension or diabetes. And coming to his clinical examination, sir, he is actually febrile and not anemic, and no evidence of jaundice or clubbing or cyanosis, sir. And his vitals are stable and his weight is about 57.6 kilograms, sir.
Okay, so it appears to us that he's got drug sensitive TB, isn't it?
Yes, sir. Yes.
So how do you think that we can manage him?
Since his gene expert is sensitive for rifampicin, I would like to start him on drug sensitive TB regimen, and it contains like 2 months of isoniazid, rifampicin, ethambutol, and pyrazinamide, and followed by 4 months of isoniazid, rifampicin, and ethambutol, sir.
Okay,
Okay, sir.
great. So what do you think if he had already received anti-TB treatment? So how are we going to manage him? Is it going to be a change in the treatment?
No, sir. Irrespective of his previous treatment started, still I would continue with the regimen for drug sensitive TB. So, in the meantime, I will also send a sample for drug sensitivity. If it is turned out to be resistant for rifampicin, I enhance and I will follow the treatment guidelines for drug resistant TB, sir.
Okay, that's great. So let's imagine that you are in a remote location, that you don't have facility to do the DST, or you are not able to collect the specimen from him. So what will you do in that condition?
So, still I will start him on the treatment immediately and I will follow him up clinically and radiologically if there is any signs of non-responsiveness, sir.
Okay, that's good. So how about the drug dosage that you mentioned about the drugs?
Yes, sir.
So what is the dosage of those drugs that you
As
want
per
to
the
give?
guidelines, I will start him on according to his weight, sir. Yeah, there are various weight bands for each weight category, sir. So I will start him on according to his weight, sir.
Okay. So before that we start him on the treatment, what are the things that you would do?
Sir, I will give a pre-counseling to him.
Okay.
I will tell him the importance of continuing treatment in the entire treatment duration without skipping the medicine, and I will ensure the adherence to the medicine, sir.
Okay, Shruti, so you said it right. So pre-treatment counseling is very, very important. So we need to talk to the patient about the nature of the disease, the mode of spread, and also the causative organism. Not only that, the total duration that you should be taking the treatment. And it's important for us to educate him about the consequences of interrupting his treatment and also importance of taking his treatment regularly. And apart from that, we need to talk to him about the adverse effects of the drugs that we're going to start him. Especially, rifampicin, it can cause reddish color urine, and he should be aware of that. He should not get scared. And we should also educate him about the cough etiquette. When he's in public place or when he's at home, you should follow cough hygiene so that the TB disease, or the bacteria doesn't spread to others. So to whom are you going to give the TB preventive therapy?
Sir, I will investigate all the symptomatic household contacts for active TB. If the person is less than 5 years old, I will right away start the TB preventive therapy if there is no contraindication. If it's above 5 years old, sir, look into the IGRA and TST. Then, if it is positive, then only I will start the TB preventive therapy, sir.
So now we're going to start him on the treatment. How are you going to monitor his treatment?
Sir, I will advise him to enroll into NTEP, that is National Tuberculosis Elimination Program. It is basically a patient-centered program, sir, and they have healthcare workers or community volunteers to monitor the adherence of the treatment. And I also heard that they are sending SMS notification to the patient to ensure the adherence of the tablet intake, sir. Sir, I have a doubt. If the patient want to take a treatment from the private setup, is it possible?
Yes, definitely. We should respect the patient choice, whether be it a public provider or private provider. But most importantly, what we need to ensure that he completes the treatment. And also, the providers should monitor the progress of the treatment and they need to inform us if there's any problem. This is the most important thing. And also, we need to notify this patient to the government. So please make sure, take all kind of steps to notify this under the TB notification initiative so that it gets registered as a case into the system, and the monitoring will also be done through the program. Shruti, how are you going to monitor this patient?
Sir, I will be monitoring the patient every month regarding the clinical improvement, symptoms, and I will also be taking the sputum samples at the end of intensive phase and continuation phase. At any point of time, the sputum is positive, I will also do a DST. And regarding the chest X-ray, if indicated, we can do a chest X-ray also, sir.
So one most important question is, when will you stop this treatment?
Sir, at the end of the treatment, if the sputum is turned out to be negative, we can stop the treatment, sir.
Okay, that is good.
Yes, sir. Sir, I have one more doubt, sir. If the chest X-ray still shows some lesion, should we continue the treatment or should we change the treatment, sir?
No, that is a very, very important question, because as long as he's clinically improving, his symptoms are resolving and his sputum is negative, we don't have to continue his treatment, because the chest X-ray, the lesions in the lung can take longer time to resolve, and we don't have to really worry about that as long as he's clinically improving. So chest X-ray lesions alone does not warrant the extension of the treatment. So you should know that.
Okay, sir. Okay.
So Shruti, excellent. So can you summarize the points that we discussed just now?
Yes, sir. Whenever the patient comes, I will take a thorough history, sir. Like this patient, I will take a history of his comorbid illnesses, previous history, and I will get the gene expert result as soon as possible. Then, if it is sensitive for drugs and rifampicin, I will right away start him on regimen for drug sensitive TB. And sir, as you enlightened me, I won't continue the treatments if the chest lesions are still positive. If his symptoms are improving, also there is his sputum is negative, sir.
Excellent. Great.
And also, I will ensure that adherence to treatment, sir.
Okay, that's good. Shruti, are you clear about it
Yes,
now?
sir.
Okay.
I will go and right away start the treatment, sir.
Okay.
Thank you, sir.
Thank you, Shruti.